You are live, Dr. Emer.
Hey guys, we're back, and if you've been paying attention, it's always our Rejuvenating Fridays, and we're doing one of my favorite treatments, BRO-TOX. Some people call it Dysport or Xeomin treatment. And this is one of my younger patients who is doing all this for prevention. He doesn't want to get wrinkles around his eyes, in the center part of his forehead, so he's doing this as maintenance to just keep everything looking lifted and looking soft. And in the years that I've known him, he looks younger, so he always looks younger, and that's the key of doing these treatments. So what we do is squeeze in, and he can't really move in. There we go, perfect. You can see the lines that would be developing here, these movement lines of the glabella or 11 lines, if we didn't do Botox. But we're doing Botox there to prevent any of those lines so that he looks really approachable, so he looks, eyes are open, softer. So we're gonna do each of these muscle groups where he squeezes. And the key is to find somebody that really knows your muscle and what look you're going for, because then they can really customize this and keep it preventative and they understand you. We do each of those areas that we just treated, and then we go to around the eye area. So we did that center area, so squeeze it again. You can see where his muscle was squeezing, all those muscles are going to be softened, and then smile as big as you can. We're looking at all this area. We're going to start from the top up here just a little bit. There we do a small bit, then we do the matzo ball technique. We do a big dose right in this middle. And we do another smaller dose on the side. And then we just smash it down, okay? That's the matzo ball technique for all my New Yorkers out there. And then we're gonna come to the other side. He's gonna turn a little bit, smile again. These are the lines that people start to see, although over here he doesn't really have a lot, he has no lines actually, and very little movement. So we're gonna keep this maintenance, so we're gonna do a bigger bleb in the middle.
How many units do you use around the eyes?
Well, it depends. Right now I'm doing a special combination where I do Dysport around the eyes, but I do Botox in the center, because I think that, especially for men, I like a little bit more of a spreadability in this area around here, so that all of this gets affected. And then here I like it more targeted, so I'm using the Botox in the center. So when he smiles, take a look, we hit all the areas of movement, right here in the corner, in the brow, and on the edge, and then squeeze in again, we hit all the areas of movement here. So all that remains now is the texture of the skin, which we're gonna do lasers. For younger guys, I always say, especially right here where the skin is thinner, once every couple years to do a super strong laser there, like a CO2, but the rest of the face, we do things like BBL, halo, microneedling radiofrequency, PRP, to just keep that texture looking really good. And that's what we're gonna do. That's his regular maintenance treatment, and we did excellent with his maintenance Botox.
Can you permanently prevent wrinkles if you use Botox consistently?
Yes, so for movement wrinkles, you can permanently prevent them. But for textural wrinkles that occur with sun damage and aging and overall elasticity changes from the skin, you need to do peels, lasers, microneedling, and skincare.
And how often do you have to do this? Like
Every 3 months, and some guys it's every 2 months because they metabolize the Botox a lot quickly. Some people it lasts up to 4 to 6 months when they're doing it for sweating. So you never know. Migraines and sweating might last a little bit more, but for the movement wrinkles, typically with guys, it's 2 to 3 months. All right, have a good night. Now you get to enjoy your weekend. All right, cool. So why don't we